friends. I am so glad you're here. Whether you're watching live or gathered in a home or catching the replay, I want to thank you for giving us your time. If you are live, please say hi in the chat and feel free to drop a question there anytime. And if you want to learn more after tonight, visit our website at HaitiEmpowered.org or email us at info@HaitiEmpowered.org. If you're new, here's who we are. We believe that where a child is born should not determine their future. We serve in Haiti alongside Haitian leaders, building sustainable change that lasts for generations. Our vision is to see generations of Haitians empowered and transformed, fostering sustainability for a brighter future. And our mission is to equip children to reach their full potential through education, nutritious meals, healthcare for their family, employment for Haitians, and the hope found in Jesus. Now tonight, we're going to focus on one piece of the mission, healthcare. I want you to imagine your child wakes up with a fever. You know what to do. You can get answers. Now imagine you don't have that. For many families in Haiti, delayed care isn't a phrase. It's normal life. Tonight, you're going to meet the people who show up every day to care for our 2,800 students, their families, and their community. Take a breath, lean in. Now let's begin. Now, when most people think about healthcare, they don't usually think of this first, dentistry. Now, for many of us, going to the dentist is routine, maybe even something we postpone or complain about. But in Haiti, dental care isn't cosmetic. It isn't optional. It's the difference between eating or not eating, sleeping and not sleeping, living in constant pain, or finally getting relief. And untreated infections don't just stay in the mouth, they spread. And where access is limited, something small can become life-threatening. Now, before we had a permanent clinic, a couple traveled with us on a mission trip, and one of them is a dentist. What they experienced helped shape the direction of Haiti Empowered. I want you to hear their story. Meet the Mulroys.
You know, we would see people living in like stick huts. So they deserve to have safety of walls and security so that at the end of a long day when they're serving patients, children and their families, they can go home and rest and feel secure and feel safe. So it's not just about like, all right, let's buy some equipment and let's send down some medicine. Let's take really good care of the staff so that they can invest again into their own community. So as soon as I met Tom and he was in dental school and I knew he was going to become a dentist, I knew that we were going to go on a dental missions trip. It was like my plan from the get-go. And somebody once told me that a lot of times men need to remember to let their wives give on their behalf. So he didn't even see this really coming. I totally signed us up for this. And I just knew the timing was right. And that if we waited any longer, it might be something that like we would never do. And so I reached out to a friend who was interning there and I was like, can you please hook us up? Because we really need to go give some of what God has given to us back to his kingdom.
People thought we were crazy, but we decided that it was, we felt so blessed and we wanted to reach out to those in need and thought it could be an opportunity to serve. So we had already been doing like preschool outreaches too, where we'd go
because we had little kids.
We had the little dinosaur dude, the
Dexter,
purple Dexter the dinosaur, and we had fun with it. Yeah, we were like, let's get a bunch of toothbrushes, toothpaste, tubes, and
I don't think
we got medicine too. We got amoxicillin. We were like, come bring down whatever we could, and
but I don't think we expected to see things.
It was eye-opening coming from like a country like this where there's like the wealth, the lights, everything you see, and you land somewhere down there and they don't have electricity for periods of time.
Right. They picked all of us up at the airport and we got on this bus and started driving towards the mission, and the bus broke down on the side of the road on the way there.
Yeah, that was
and so we're standing on the side of the road and we're looking around and we're like, this is unlike anything I mean, Haiti in 2018 was unlike anything I had ever experienced. The hopelessness and the culture of darkness was just, it was like textural, spiritual. You could just feel it. We were taken to this little village where, sorry, this is like just bringing back so many memories that I haven't actually thought of for a long time. We went to this little village and there was all these children running around playing soccer. And one of the little boys was playing soccer with no pants on, no underwear, just t-shirt and nude. And I was like, this is crazy. And this woman came over and she tried to hand me her baby. And it was just so upsetting to see so many women with children and no husbands because there's no marriage supported there.
You see like the poverty and the way they live, and there's a lot of trash in Haiti and they burn piles of it, so there's the smells. I mean, all your senses, you're seeing things, you're smelling things, you're feeling awful because we are so blessed in this country. Then when we got to the headquarters, you just start seeing like the smiles and the laughter of the children, and you start visiting the schools that Haiti Empowers supporting, and you start to see just what is like pure joy in life.
Some of the children from another one of Haiti Empowered schools, they had just gotten off school for the day. And there was this little boy that saw our group.
He was literally 6 years old.
He was so cute. His cute pink shirt
from school
with his books
his
and his shorts, and he was so clean. He walked. Well, the school kids dress well. The little children in the village, they weren't Haiti Empowered sponsored kids. They didn't have clothes. But then this little boy who was a part of our schools with his cute little pink check shirt and his little navy pants was walking home from school. He was so cute. He was riding on his shoulders. We got to the front of his home, and there in the front yard was his mother and his father, showing like solid family. And they threw open their arms. He wasn't afraid walking home from school. It was like that was his neighborhood. We were nervous for him, but he wasn't nervous at all. But his mom and his dad were there, and they were married in the church, and they were providing a solid family for that little boy. And that was just like I saw on one day, this mom with no support willing to give away her child. And then a child who was safe and secure with a school and a family. And it's like two sides of a coin. I just wish we could have done it for every single kid in that country. You're in these ghettos, basically, and you're given processed food because there is no healthy options. So it's not like they're munching on an apple, they're chewing on processed foods. So that's why I think that there's a great need for dental care in that country.
Preventative care is so important to prevent diseases that then can become systemic too. In the past, it was always like trying to get equipment and clinics set up. That was a big, so that requires, funding and manpower and locating equipment and getting the proper permits and getting it set up. I know that you mentioned a lot of this care is being done, at a goodwill, and but it has to be funded, it has to be supplied, to having the people that, work it, run it, take care of people, prevent someone from dying from an infection, because that is possible. And if you have a dental infection, it could spread to other, serious parts of your body and cause death.
That small thing that we did was a seed that was planted when we went down there. It was just a tiny little room with some para nurses, and we were able to bring and shine a light and give financially so that we could, fund the equipment so that they could start this clinic. And now just look, a few short years later, there's actually real medical staff and the possibility of a lab.
You are being given almost a gift in a profession and a skill set, and you receive a lot of benefits from it. And you also need to reach out and give back. We need to be involved in our communities in a way that we can support those in need around us. It's amazing to go to such an impoverished country and you see all of that, but then you still see the families and the children just having simple joy and laughter with each other. the values I think that are being taught, especially through Haiti Empowered. My hope is that that continues to grow and you continue to see, safe communities and things like that.
When we are done with this mortal life here on this earth, we get to go see our Savior and say, like, you gave us one little talent and we grew it. So that is a gift to us. It's not just us giving. We have received so much more.
Now, what they saw wasn't rare. It was reality, and it changed us because a child in constant pain cannot learn well. An infection steals strength from the whole body. So instead of responding occasionally, we made a commitment and built something permanent. Now, I want you to meet the man carrying that commitment every day. Our dentist, Dr. Dorival.
Hello, I am Dr. Dorival Blondie. I'm an oral surgeon here. I am here to serve the Leogan community, as well as the students and other persons here when it comes to oral and dental health. The most common health issues, I treat patients with tooth decay. I find this in the students. I find the same tooth decay issue and people who don't reside in the community. I treat those cases. Those are the most common. The biggest challenge I face daily are having supply and tools issues. Sometimes we can use a tool to do the work, but the best tool that could facilitate our work a lot better, make it better and faster, we still don't have those. Such as we have a curette, which is associated with tooth extraction, other tools such as the elevator, but their tips are broken. We use them because that's all we have, but they are not in good shape. They can't really do the work we need to do for our patient. Oftentimes, they come to the clinic with problems or issues. They don't even know what it is. So you have to explain it to the terms that they understand so that you can begin teach them and train them. For example, I use the model, the mannequin that I have here. I will tell the students, some parents or patients about an issue, a sickness. They really don't understand it. So you have to use the mannequin as a model on all the issues that they're facing. A lot of times when we do it like this, some of them will understand, some won't. Sometimes they show up and tell you that they need a tooth extraction. But when you look at it and realize that it has nothing to do with the extraction, oh, they provide you another treatment issue. They say, no, you got to take off the tooth. You got to get it out. You sometimes have to persuade them that taking out the tooth is not a necessity. For me personally, my issue was that I had my bottom tooth was overlapping my top and they weren't aligned properly, and it gave me so much issues. And when I was referred to come here, in the beginning I was doubting their service, but as I started watching everyone and then I started taking part of their services and seeing the results in person, it was extraordinary. For me, having access to a dentist means a lot. As you know, in life, smiling is so important. So for me, who had issues with my teeth and I couldn't smile, it gave me such discomfort around people. So having access, I can smile widely everywhere I go.
That's a normal day, just a Tuesday. Unfortunately, most of what he treats is preventable, but access changes everything. Now, Dr. Mulroy said something in that first video that keeps echoing in my mind. As dentists, we've been given a gift, and with that gift comes responsibility. Now, the truth is, the same is true for all of us. Some of us are called to go, some are called to serve, and some are called to give. If you believe healthcare should not depend on geography, if you believe children deserve relief from preventable pain, we invite you to partner with us. And if giving financially isn't possible right now, you can still share this. You can tell others, maybe share this with your dentist. And you can pray for others to be moved to help stand in the gap. Please follow the QR code on the screen. Now, I want to shift your attention because dentistry is only part of the story. Far before we had a permanent clinic, we led many mission trips into Haiti. In fact, one of the people who led some of those trips is Jody Ellingson, our Director of Partner Relationships. Jody, thanks for being here today.
Yeah, it's great to see you.
Now, one of the very first stories I remember you telling me right after I started was an incredible story that happened about a little girl who was involved in an accident. Can you share that?
Yes, I witnessed something that I'll never forget. I was down on a mission trip. I was in the courtyard, and the team was out at the school. And we have outside of our campus, there is a dirt road with rocks, dirt, everything on it. We have, that day, I was standing there and I heard a screeching noise. I heard a scream. I heard a couple of mumblings in Creole, and I saw our security guard run out of the gate. A few seconds later, he came running in, holding a teenage girl from our high school, limp in his arms. So I ran over to the medical clinic thinking maybe I could help. So I went to the supply cabinet. I was getting all the gauze bandages out and went over, and I heard Nurse Berlin praying over this little girl laying on the floor. And I walked over to see her, and I thought, I went to the medical clinic and she went to prayer to God.
Wow, that is incredible. That moment, it still gives me chills because it shows the difference. In Haiti, faith isn't added to medicine. It's the foundation, and especially when resources are limited. And one of those doctors who lives that every single day is Dr. Diami. You're about to step into her world. You're going to hear the challenges she faces, not occasionally, but every single day. Let me introduce you to Dr. Diami.
I am Dr. Jami Saint-Just. I am the doctor that is working here at the clinic in Léogâne. We see everyone here, from the oldest person to the youngest person to our youth. We see people with hypertension, H. pylori, malaria, typhoid, skin infections, and many, many different infections. The list goes on. If someone needs lab tests, we send them to the closest possible lab if it's available. Then, if they do return with result, we give them some prescription, but so most of the time they don't return. We see 28 to 30 people per day, and sometimes even more, but that is our normal schedule. The biggest difficulty that we face every day is that we don't have enough supplies or tools. There are many times we want to provide the bigger services, but we are limited. We are limited with the tools and the supplies. At times we look at our patients, they are suffering, they need our help, but we can only work within our limits and what we have available. But what we are facing is lack of supplies. One of the biggest difficulty without a lab here is that we have to send our children far away, but the cost is so high and expensive, and the kids aren't able to complete their lab work and provide us with the results. And many times their care have deteriorated, and without the result of this lab, we cannot provide the services. And many times we send them with the paperwork and the documents that they need, paperwork for the lab work. They will return and tell us they've lost it and everything is so expensive we couldn't do the work. Now this medical emergency has gotten worse. When there is a delay in the result, many times for these children, as a doctor, you don't want to lose hope, but their situation gets worse. As a result, you can't just give them an empty diagnostic. You need the result. Many chances when we take all this time and they don't get their lab result, the child could die. What service that I receive is that I had an unbearable stomach ache. We didn't have a lab here that can provide the services that I need. They provided me with medications for the stomach ache that I had, and I took them, so I believe that they are okay for the services. I had a typhoid and malaria. I saw the doctor and she sent me to go get a lab work, and I went and did it, and the lab results were positive. Once the results came back, she gave me medications and prescription. I follow her guidance, even though there was still some tracing of the malaria. However, I have received some great services and positive results of the services that I receive. When a child comes here and they are malnourished, it affects them in every category, even their capacity to learn in school. Now, when you think when they are malnourished and they need health emergency reaction, they have a weak immune system. Their body does not respond properly to the medication that they need. It is not effective. It takes much longer for them to heal. It is so much different from someone who is actually in good health. So malnutrition is one of our biggest problems here in Leogane. The way we educate the patients, the kids, on nutrition and health services, every single one of our patients, they get a one-on-one conversation with us. We do an intake. We talk about what kind of water they should drink, sanitary action, nutrition, what is healthy, how do you eat. Every single patient gets counseling before they leave. This is the only way we can affect change here in a community in Leogane. What motivates me every day to come here and work every day? Well, there are many reasons. When I come here, I feel like I am at home. I'm relaxed. I'm at peace. The patients respect and love what I do. They show so much gratitude for our service. When a patient lives here, she comes back and said, thank you very much for the medication and the service you provide me. I feel good. I bring others who need help. I talk about the clinic and the services they provide. That is the source of my motivation every day.
She shows such strength, commitment, and faith. And yet, there are limits when symptoms aren't obvious and when treatment doesn't work as expected. Without an on-site lab, samples have to be sent away, and waiting costs time. And in medicine, time matters. So, what if we could change that? What if instead of sending samples away or sending families into unsafe areas, we could test right here? Let me show you something.
Welcome to our space. As you can see, we have started installing the countertops because this is where we are building our laboratory. This area right here is where we will receive our patients. Our receptionists will be stationed here. It is absolutely beautiful. It's a great, decent sized space for our lab. In this lab, we will run tests, a lot of different tests. The common cases that we see here, we see malaria, typhoid, H. pylori, diabetes, hypertension, pregnancy, so many exams that we'll be conducting. All of these will be able to be taken care of here in our town. What changes will this bring to our community? Well, having a lab available locally will increase the quality of service we provide. We won't need to send our patients to outside locations, out of the community. Many times, they don't return when they go elsewhere. Oftentimes, it's difficult for them. A lot of issues with funding, and it prevents them from coming back. But if it's here, we can teach them, we can take care of them here, and they get better service faster. Many times when they go to other areas, it costs so much for them to receive these lab work, and many times they don't return back to us. But if we have it here locally, it will allow us to get the results faster. It allows us to help them in terms of cost association because it's less expensive for them. And here, we will take care of them in Leogane, our area. We want to say thank you to all of our sponsors. The work that they are doing, the support for Haiti, the support of our clinic here and our community here in Leogane, our Haitian community. There are a lot of diseases and sickness, but we are here to combat that and prevent some of them as much as we can. And it doesn't cost them much to get the services.
This is a real space we already own. With the right equipment and a lab technician, this room becomes faster diagnoses, earlier treatment, and better outcomes. Now, tools don't replace faith. They strengthen what our doctors are already doing. And to help explain why this matters medically, we asked Dr. Peter Daly, founder of One World Surgery and Mayo Clinic Humanitarian Award recipient, to share what he's seen around the world. Now, Dr. Daly has served in communities around the world and is described as a true servant, filled with kindness, humility, and compassion. He's known and described as a dreamer and a doer, and we're blessed to have him with us today. Thank you so much for being here.
Thank you for having me.
Yes. Well, why don't you start by just telling us a little bit about yourself and give us a little bit of your background?
Well, for my occupation, I'm an orthopedic surgeon. I practice principally in St. Paul, Minneapolis. And I'm married, I have 4 children, several grandchildren, and God willing, more to come. But I've been interested in global health throughout my career, and I've always wanted to incorporate my family involvement with that. So as I went through the 1990s and volunteered at some different organizations, I just couldn't have my family involvement with me as well. And it was important for me to do things such as a service trip with my family to teach my kids that they can see, their mom and dad serving, and they can create that example to carry that into their adult life as they've done. But it's allowed me to see also, as we started our own surgical facility in Honduras in the early 2000s, what are some of the barriers to getting a facility equipped and running, and through some of the other difficulties and side services that are needed to run a healthcare facility. And that's why I was particularly interested in talking with you about some of your goals as you're attempting to also serve some needs globally.
Thank you for that. So you obviously saw this when you were in Honduras, and I know that you've served in places like Haiti as well. What happens when you go into a place where children and frankly, even adults don't have easy access to medical care or to appropriate diagnostic testing?
Yes. Well, what happens is if they don't have the access, they simply don't get the care. And when you have something that is initially a fairly simple situation, in my world of orthopedics, we take care of a lot of fractures, of course. And it may be a very simple fracture that could be easily aligned in a cast and treated non-surgically. And when that's delayed and it becomes a malunion or heals in a crooked direction, that becomes a very complex problem that requires more of a big intervention to correct the deformities and the disability associated with it. And the same could go with all kinds of medical topics, hypertension, or things that are unaccounted for wind up with a stroke, or a child with a small infection. If that gets an abscess, then all of a sudden they've got a mechanical pressure on their brain or on another part of their body that can be very disabling.
So I'm sure that you probably even saw some of that, where a patient would come in and you were like, if we would have just seen this sooner. Can you think of a case where that happened and where you thought, if only this, then we wouldn't be here today?
Oh, certainly. Well, the most obvious case was this 9-year-old girl that had a growth plate deformity that was just unrecognized, and once recognized was untreated for several years. So by the time she became 9, she was had so many deformities and things that it wouldn't be solved with monitoring the growth plate or modifying the growth plates of the affected parts of her lower extremities in this situation, and her upper extremities. And then it required more of a major surgery. And the experience that I had was that she came, we realized that she couldn't get the care in Honduras, and she came and lived with us for a year in Minnesota and got a lot of care through a lot of generous situations. And for her growth plate abnormality had already progressed by her age 9 to have her in a wheelchair. I mean, she simply couldn't walk, she couldn't run. And the public shunning of an individual that disabled in those kind of cultures, there's just no future for them. Her employment future would be markedly limited, and just her spirit of what she felt like she could do. So it was time to intervene, and it required a much bigger intervention, of course. That's one person and one patient, and it had a profound effect on myself and my family, and hence we really, after that, we were all in on global health. But so just as Haiti Empowered is trying to build the infrastructure, the facility to handle the things in their environment there, you can't bring every child out of Haiti to get their care. And so to build that infrastructure is so important. And that's what prompted me to say, well, gosh, we have to find a facility or build one to handle some of these solutions or propose these solutions in country. And that's what's so unique about global health. It's really empowering the people in that country with the skills from the riches that we have in our high-income country of the United States.
Now, many of the children and adults that we serve are already vulnerable. They may be dealing with other types of diseases, and then they, that's kind of underlying, and then they come in and they've had, a fracture, a break, or something else. How do all of those things work together that changes the equation when they get sick with something else?
Yeah, it compounds it, and it complicates the situation, of course. I mean, patients that are malnourished don't heal as well. They have a higher incidence of infection when they're malnourished. They can't fight off the infections. They just don't have the energy to overcome them. And that's worse also on the two extremes of life, the very young, the infants and patients under the age of 5, and then certainly those that are very elderly. And so both the elderly and the very young children can get sick very quickly. Children, different from elderly, can get better very quickly also. And so they're amazingly resilient, but you have to try to help them within that window of time to let them bounce back without permanent sequelae. Particularly with nutrition, if you if you have a child that doesn't get adequate nutrition in that first 2 to 3 years of life, they can have some significant intellectual and learning disabilities. So that nutritional exposure before age 3 is uniquely important to not disable them or handicap them in their learning abilities going forward.
You have had the unique ability to go in and see a lot in these other countries. What do you wish people really understood who haven't been confronted or who haven't seen it in person?
Yes. There's nothing better than seeing it. And I know Haiti's got such a desperate security situation that you can't really go visit there. But even the power of, these videos, or as I know we've talked about the virtual visits that your organization is working with, can be very powerful because it can really illustrate and give them an idea of what life is like for 90% of the world. And we just are in such a bubble, in our environment, and we're called to be aware of what's going on globally. And it's just, I think it's just a moral necessity to open your eyes and have some idea of the Lazarus that's outside your door that we're stepping over, as we know from that gospel story. And the person in that Lazarus story didn't do anything wrong. They probably were donating to the Save the Bird Foundation or whatever great thing, and they took care of their yard perfectly, but it didn't end well for that person in that gospel story because they just didn't see what was right in front of them. And we have so many opportunities to see what's in front of us. If we can't get there by an experience, we can at least be aware of it through some of this education you all are providing.
That's great. So if you could speak directly to the people watching here tonight, how would you explain the importance of appropriate diagnostic tools?
Well, it's critically important. If you don't know what you have, you can't treat it. And so many people in Haiti, I'm certain, die of something and they never even got a diagnosis. So the first piece of the puzzle is to evaluate the patient, your clinic, your health setup that you've established with the doctor and the dentist and things. At least they can identify what the diagnosis is, and I'm sure their clinical skills are amazing. They don't rely on MRIs to make a diagnosis. They examine the patient, take a history, and they know their environment. So I'm anticipating that they understand diagnoses there for the most part, but to really provide the treatment, they do need some diagnostic tools, and labs are a critical part of it. Imaging is also important, of course. And once they can get those other pieces of the puzzle for information, they can come up with an appropriate plan to help care for those people. So I would add that you've identified some things that are necessary. And if you can at least start out with doing what's necessary, and then the next step is doing what's possible, and maybe that's some of the lab and diagnostic equipment. And then the next thing you'll find with God's grace is that you're doing what is impossible. Mm. And that's the multiplying factor that Haiti Empowered is probably about. And making more people aware that if we could just get those diagnostic tools in their hands of lab values and help direct them to the correct diagnosis, then the treatment is the next step. And many treatments are fairly straightforward and very available, but you need to know what you're dealing with first.
Thank you so much. I really appreciate you coming in and talking with me today and sharing your knowledge and your experience with all of us.
Well, thank you. Any way I can help a global health effort, I'm game. So thank you.
Excellent. Now, I want to be very clear. Our clinic is functioning. This is not rescuing something that's failing. It's strengthening something already working. And tonight, we're inviting medical professionals into 3 clear pathways. First, we have the Dental Collective. We're looking for 8 dentists at $4,000 per year to underwrite medications, maintenance, and personnel. 8 dentists who can say, we've got the dentist. And then a medical collective. We're looking for 10 medical professionals at just $4,200 per year to sustain all of our clinic operations. 10 people who can say, we've got the doctor. And then the lab initiative. To equip a new lab, $30,000. To sustain it annually, $18,600 for the technician and supplies. Now, supplies in Haiti can fluctuate, so these numbers do include margin, and over time, costs will rise. But this isn't a wish list. It's a responsible plan. And if you're in healthcare, this is your lane. And if not, you can still be a partner who helps put tools in the hands of those who are. The QR code is on your screen, and if you feel called to respond, please do so now. Now, before we close tonight, I just want to make sure that we do get all of those questions answered. So please make sure that you've written them in the chat, or you can also email us at info@HaitiEmpowered.org, and we will get back to you as soon as possible. If you're not in medicine, but you feel moved, you still matter here. Empowering doctors requires partners who fund the tools and the infrastructure. I want to thank you for caring, and I want to thank you for believing that a child's future shouldn't depend on where they're born. Now, I do want to close us in prayer. Please join me. Father, I want to thank you. I want to thank you for the people watching tonight, and for the doctors, the dentists, the nurses, the caregivers who are serving faithfully every single day. We pray for the families in Haiti who depend on this clinic. Please strengthen Dr. Diami and Dr. Dorval. Strengthen every member of the team who's serving here. Lord, provide the tools that are needed and raise up partners who will stand with this work. Raise up medical professionals who will feel called to be a part of this mission. And most of all, let every single child who walks through those clinic doors experience not only the healing for their physical body, but from the hope that comes only from you. We trust you with what comes next. In Jesus' name, amen. I want to thank you again for being with us tonight. Good night, and thank you for standing with Haiti.